Hello friends. There are several approaches to tackle the menace of heart disease. One of them is nutritional approach based on plant-based diet. I am Dr. Balaram Dhotre, a researcher by profession and the author of a book. Today I will be reviewing the book Prevent and Reverse Heart Disease by Dr. Caldwell B. Esselstyn. Let me start the discussion now. Dr. Caldwell B. Esselstyn has written a book called Prevent and Reverse Heart Disease. In this book he argues that eating a plant-based foods can help prevent and even reverse heart disease. Caldwell is a renowned researcher and physician. He emphasizes a dietary approach to radically alter the conventional treatment of heart disease. He advocates eliminating all animal products, dairy products, oils, and processed food. This way he aims to halt or even reverse the progression of heart disease by nurturing optimal arterial health. As a researcher and the author of Unveiling the Root Cause of Chronic Diseases, I, Dr. Balaram Dhotre, find Caldwell's approach intriguing, especially in relation to the dominant dietary views on heart disease, like those of Dr. Ancel Keys. The central theme of Caldwell's method. Caldwell's approach centers on a whole food, plant-based diet that excludes oils, animal products, and processed foods entirely. Ancel Keys recommends eating unsaturated oils. But Caldwell says you should not consume oils of any type. Not even a drop of oil. He argues that this highly disciplined approach can prevent and reverse plaque buildup in the arteries. Caldwell believes the potential of diet to impact heart health is unparalleled. By removing fats and processed foods and focusing solely on whole plant foods, he proposes that individuals can repair and restore their vascular health. For Caldwell, this method is not a temporary fix but a lifelong commitment to diet-based prevention and healing. He believes that maintaining this diet can give people control over their heart health in a way that medications or surgery cannot. Caldwell's perspective on the cause of heart disease. According to Caldwell, the primary cause of heart disease is the consumption of animal proteins, animal fats, oils, and processed foods. He says avoid all animal protein food like meat, chicken, and fish. He attributes the buildup of plaque in arteries to these foods, which he believes damage the endothelial cells lining blood vessels. Caldwell advocates the complete removal of all oils and animal-based products, arguing that these foods are responsible for most endothelial damage. His stance is that by eliminating foods high in dietary cholesterol and fats, one can protect and even reverse heart disease. Caldwell's views compared to Dr. Ancel Keys' theory. Caldwell's ideas echo parts of Dr. Ancel Keys' influential theory that saturated fats and dietary cholesterol contribute to heart disease. Keys argued that reducing saturated fat intake could reduce heart disease risk. However, while Keys focused on limiting saturated fats, Caldwell extends this by advocating for the complete elimination of all oils and animal-based foods, not just those high in saturated fats. In this sense, Caldwell's approach is stricter than Keys' theory and pushes the concept further. Both agree on the dangers of certain dietary fats, but Esselstyn's more rigorous diet, which centers solely on whole plant foods, is unique and further diverges from standard dietary recommendations. The gist of Caldwell's theory. Caldwell's theory can be broken down into three main ideas. 1. Heart disease is preventable and even reversible through plant-based diet. 2. A diet entirely based on whole plant foods, excluding oils, animal products, and processed foods, can arrest or reverse coronary artery disease. 3. The health of the endothelium, the thin layer of cells lining blood vessels, is crucial to vascular health, and a whole food, Plant-based diet can protect and heal it, reducing and even dissolving plaque buildup. Comparison with the Mediterranean and DASH diets. Caldwell's diet stands out for its strictness compared to other heart-healthy diets like the Mediterranean and DASH diets. The Mediterranean diet, for example, allows for some fish, poultry, dairy, and olive oil, with a focus on whole grains, fruits, and vegetables. The DASH diet is similar but encourages low-fat dairy and lean meats, aiming to reduce blood pressure. Both diets are considered beneficial for heart health and have been studied extensively for their cardiovascular benefits. In contrast, Caldwell's diet eliminates even the minimal amounts of oil, animal products, and dairy that the Mediterranean and DASH diets permit. Caldwell argues that even small amounts of these foods can hinder endothelial health and slow or reverse heart disease progress. While the Mediterranean and DASH diets are easier to adopt and widely recommended, Caldwell's diet is one of the strictest in terms of dietary restrictions, and he believes that this rigor is necessary for reversing severe heart disease. Time required to resolve heart disease. Caldwell's book provides cases where patients demonstrated significant improvement within a few months of following his diet. His clinical experience suggests that within weeks to months, many patients experienced reduced symptoms, decreased medication dependence, and improved cardiovascular health. However, Caldwell also notes that maintaining these benefits requires a lifelong commitment to his dietary approach. Depending on the severity of the disease, the time frame to see improvements can vary, but he believes that a dedicated approach will yield lasting heart health benefits. Societal impact and challenges of Caldwell's method. Caldwell's method has encouraged many to rethink heart disease management and prevention through diet. His work has influenced some medical professionals and institutions to consider plant-based nutrition as part of cardiovascular treatment plans. However, mainstream adoption remains limited due to the diet's restrictive nature and the cultural acceptance of more flexible eating habits. Additionally, some people find the strict dietary guidelines difficult to maintain long-term. Despite these challenges, Caldwell's work has undeniably contributed to public awareness around diet and heart health. Through his case studies and success stories, he demonstrates that his approach is not only effective but sustainable for those willing to embrace it fully. Conclusion. Prevent and Reverse Heart Disease by Dr. Caldwell B. Esselstyn is a groundbreaking book that challenges conventional heart disease treatments with a simple yet strict dietary solution. While the approach may be challenging to adopt, Caldwell's work offers a hopeful alternative for those suffering from heart disease. His focus on endothelial health and the power of diet to prevent and reverse cardiovascular disease represents a valuable addition to the field of cardiology. Whether or not one agrees with his approach, Caldwell's dedication to heart health and patient advocacy is clear. For anyone seeking an alternative or complementary method to heart disease treatment, this book presents a thought-provoking, research-backed option worthy of consideration. Thank you for watching. I hope you liked my review of the book. Your health journey matters, and together, we can continue uncovering the science behind wellness. Until next time, stay informed and take care.